First, we open both the doctor and the patient workbook. The patient names and patient-specific tasks and regimens will be uploaded to the system directly from the electronic medical record on the day of their surgery. As you can see, the patient's workbook is not yet personalized. We start with the surgeon's workbook, which provides the surgeon with an interface to personalize their patient's post-operative regimen at the point of care. The surgeon will select the patient of interest from the drop-down menu. The dashboard will use this information to generate the patient's personalized timeline. The surgeon will then click Send Timeline to Patient Interface, and the personalized timeline and name will be exported to the patient's workbook, as seen here. Prior to discharge, the surgeon or nursing staff will review the instructions with the patient to ensure that the patient understands both the Assure interface and their rehabilitation plan. The Assure interface can be accessed from remote locations in order to provide a convenient and quick response tool for the patient. The patient will open the Assure interface and his name and customized rehabilitation plan will appear. The patient should begin by reviewing the instructions under the Begin Here box on the left. This section clearly lays out what they can do in each area of the interface: daily activity log, personal recovery timeline, symptom checking diagrams, daily journal log, medicine log, healthy recipes, and daily exercise descriptions. We will describe the interaction with each of these areas in this tutorial. The patient can interact with his interface at any time. However, some things need to be completed at the end of each day. We will show you in this tutorial how one would interact with Assure if you open it at the end of the day. To begin, you will click on Open Daily Activity Log. Once you have selected this button, a pop-up box will appear advising you to click only on the tasks that you have completed today. If you have not completed an activity, a pop-up box will appear reminding you to complete it. For example, if you have only completed Take Your Medicine and Complete Exercise, the pop-up box will remind you that you need to take your morning and evening medicine. Now let's say you have done all 4 activities. A pop-up box will say that you did a good job. When you click OK from this pop-up box, your daily medicine log will also automatically update, reducing the number remaining by 1. As you can see, it is now at 4. I will show that again. If you have completed all activities and click Submit, the number of medicine remaining now goes to 3. Now let's say you only have 1 Percocet and 1 Coumadin left. Now when you complete all activities, your medicine log completely updates and tells you that you have now finished your Percocet and Coumadin and need to take 2 Advil in the morning and night. The number remaining also increases to 28 because you will be taking these 2 Advil morning and night for 2 weeks. Now, whenever you click Open Daily Activity Log and complete your activities, the number of Advil will decrease by 2. Now let's say you only have 2 remaining Advil for the morning and night. This time, when you complete all of your activities, your medicine log will change, and it will tell you that your medicine regimen has been completed. But remember, Assure will only keep track of your post-operative medications. For guidance with your regular medications, each patient should consult their own primary care physician. From here, you can review your timeline in the top right-hand corner of the interface to understand where on the recovery path you currently are. This is the imported personal recovery timeline designed by the surgeon in bar chart design. This will provide you with a summary of your overall recovery quickly and allow for comparison with your actual progression to pick up on deficiencies early. Below the timeline is the interactive symptom tracker. This provides input to the daily journal log, which will send an email to the surgeon's office. You are given a front and back view of the knee. When you click CAF, a pop-up button instructs you to check the boxes that correspond with the symptoms you are feeling. Let's say you are feeling pain, fever, redness, and other. Click Send to Daily Journal. Since you have clicked fever, an additional pop-up box appears, reminding you that if your fever is over 100 degrees, you should call your doctor immediately. Once you click OK, a second pop-up box will appear, telling you to type the other issues you are experiencing into the daily journal. Once you click OK, you will see that your symptoms have appeared under the CAF section of the daily journal log. Now do the same for incision. Let's say you are experiencing pain, swelling, and redness. Your symptoms have appeared under the incision part of the daily journal log. Now you can go to your daily journal log and type your other symptoms, or whatever you want your doctor to know, into the other box. Now click Email Daily Journal to Doctor, and an email will appear, all ready for you to send to your doctor. Now you just press Send. And you can also see that your doctor will receive the email promptly, all ready for him or her to look at. Now let's return to the patient interface. Let's move to the lifestyle sections. To encourage interaction and dashboard usage, we have included a section for healthy recipes. You can select a desired recipe from the drop-down menu, and the related recipe link will come up. For example, Tuscan white bean soup, and you click on the link, which will take you immediately to the web page with that recipe. There are over 20 recipes for the patient to choose from, all healthy, and our hope is that it will promote a healthy lifestyle that otherwise supports your recovery. Lastly, you have a daily exercise template. You first select the day of the week from the drop-down menu, and the 2 exercises associated with that day will appear. For example, on Tuesday, you must do straight leg raise and seated hip march. On Wednesday, you must do pillow squeeze and heel raise. The goal of this dashboard is to provide an environment in which the patient feels more invested in their own recovery process, increasing their chances for compliance and success. By sending updates to the surgeon's office frequently, the surgeon staff should likewise be more informed and involved in the patient's recovery. With Assure, patients will feel more connected to their doctor and be more satisfied with the level of care they are receiving. There will also be improved compliance from the patient on the activities they need to complete during recovery. This will ensure that they recover fully and will have less of a chance of post-operative complications.